how are you?
I'm doing great.
Had a good day?
How are you, Dr. Angel?
I'm okay. Had a good day?
I had a fair day.
That's enough of a medic.
Yeah.
So just a quick concern. A number of lady friends have come to me and asked a question. They said they seem to notice that their menstruation period, the number of days of their menses, as well as the amount of the flow has reduced.
Oh.
And they can't seem to attribute it to any specific reason why. They can't seem to find the reason why. Some
Which kind of
say
ladies? Which
it's the
age?
change. Most of them are reproductive age,
Okay.
not menopausal women, young reproductive age.
Okay.
Some have changed geographical location recently, travel maybe. Some use contraceptives and some
Actually,
don't.
it's a general problem.
So it's a
Actually,
general
many people
problem.
have also approached me about the same issue.
What do you think could be the reason why?
Well, you know, the issue of menstrual cycle, menstrual issues. The menstrual cycle, it is all about body physiological changes, if I can say. Because this is a cyclic thing which occurs at least at a
28
certain
to 30
period.
days.
Yes.
Yeah.
Well, if I can remember about what we discussed in class, about the menstrual cycle, irregularities, whether it reduces in number or increases. You said some travel, right?
Yeah.
First of all, when you travel is an issue.
How?
When a woman travels from one area to the other area, especially you change the time zone.
Time zone is important. Wow.
Yes,
Tell me
you know,
more.
first of all, you change altitude when you have a flight. You change
And if I
altitude.
travel by bus?
Well, that's well, because you are changing the weather.
Physical environment,
Yes,
changes
yes.
ecosystem, I say.
And especially, assume you travel from an area of a dry area, let me say, with the high temperatures,
Very humid,
and you go to an area with the reduced temperatures, maybe cold.
very chilly and cold.
Your body always has to change or adapt to the new environment. So during that change or during that adoption or from this area to this area, you know our bodies have mechanism. They keep changing from, like they try to defend themselves and fight or
To adjust.
Yes.
After
During
that
that adjustment, there are hormonal changes.
So weather is one issue.
You find a woman is reducing the number of days, or even totally she receives no menses, or
And that
increased.
has nothing to do with infertility.
No,
and their
please.
environment. So it
Actually,
should be
after 3 months, when the body has now recognized the new environment, they go back to their normal menses.
Some say they also see a change in the quality of the
Yeah,
flow.
of
They're used
course.
to something darker and it's now lighter and pale.
Yeah, I can advise maybe your women, they shouldn't get worried about that.
So
Yeah.
geographical location is
Yeah,
something. What
yeah.
else could it be?
Maybe also something to do with the PCO. It can be a sign.
Really? Polycystic ovarian syndrome
Yeah,
out of the blue.
It
Okay.
can be a sign, you know, polycystic ovarian syndrome. It deals almost directly with the hormones. Yeah, you'll find a woman is getting hormonal imbalance. It can be a sign. Yeah, you know, you have no menses, you have not traveled of recent, you have not changed the weather environment,
You haven't changed diet.
you have not changed that, you are not on family planning, then you may suspect PCOS might be setting in. Also, menopause can be another issue that it is now
Menopause at
setting in.
35, at 38.
Well, some people have early menopause.
How
Yeah.
early can early be?
You know, menopause can be also dependent, or can depend on the time you started your menses.
So the earlier you started, the
Yeah, it
earlier
can
you
also
stop.
impact on the time of
Okay.
stopping. Yeah, some people start their menses.
So on average, how early can someone stop? How many years from the age of first menopause can someone be given?
Well, I have received a lot of clients coming in with their daughters at 9 years. They started the menses.
So that means they're most likely to
Yeah,
have menopause
yes,
early.
yes.
How many years from the age of 9 could you give them an estimate?
Well, what I do always, there is a calculation we do. You get 33 plus 33 is a constant age. You add it on the years you started your
On average.
menarche. Yes.
So
that's
33 plus 9 should be about 42 for such a
yes. So we expect at 42. At least that's what we call a childbearing age. Yeah. From there, I don't think she can conceive anymore. That's the average age I can give for that.
So contraceptives could be PCOS. How would contraceptives affect them?
Of course, so especially these hormonal therapies, hormonal contraceptives. Some contains estrogen, some contains progesterone, so or some even are combined. Those one can impact on your cycle.
If someone has just started.
Yes. Yeah, actually it is one of the side effects to some, because if you're on family planning methods,
right, and they stop.
yeah. Or else, even themselves, there are people on family planning methods and actually they are receiving no menses.
Yeah, that's possible.
Yes,
but when they stop,
yeah.
So it takes quite an amount of time.
When you stop,
to go
also,
back to normal.
you give it a time range, it can go back to normal. I think you need to advise them like that. If they had a family planning method before,
and how can they be sure it's not a fertility issue? Take tests?
they can do a hormonal profile test. Actually, you can be able to detect even which hormone is actually disturbing you.
And we are actually usually told to have take 4 things into consideration before choosing a treatment modality or test preparation. How available, how accessible, how affordable, and how effective is doing hormonal level tests.
Basically, let me tell you
How
something.
affordable is it, first of all?
It's not cheap. Because basically there are approximately about 7 hormones I would prefer for a woman to know.
What could those be? You could list some.
So we have estrogen, progesterone, prolactin for the breasts. We have the follicle-stimulating hormone, the luteinizing hormone, sometimes also AMH, anti-malarial hormone. Those are basically hormones for a woman, at least, which can influence her cycle. Maybe with also thyroid-stimulating hormone or thyroid hormones. But those ones not so
Rarely
much.
affect the menstrual cycle and fertility.
Yeah. Those are the basic hormones I would prefer maybe a woman to do tests.
So it's expensive, that's affordability bit. How accessible though? Maybe
Because
it's expensive but accessible.
Yeah, they are accessible actually. These modern labs of recent, they do them.
Diagnostic.
But they consider each hormone. Yes,
How
pricing.
effective and accurate?
It's
Could it
actually,
be a whistleblower that insinuates infertility and someone is not yet
of course you
infertile?
can. If you target this one, if you target a woman's cycle, you know the menstrual cycle has phases. She must be sure of which phase she's in.
So that literally means being attached to a fertility specialist.
Yes. If I know the phase the woman has done the test, I can know that there is a problem.
So there's actually tests to let you know what phase of your menstrual
Because
cycle
they
is.
fluctuate according to the phase.
Oh,
Yes.
wow.
If you're in menses, you'll find there's a reduced hormone for progesterone. Towards ovulation, you'll find there's increased luteinizing hormone. Or, even during pregnancy, you realize there's an increased progesterone hormone. So it depends on the phase you are doing the test. That's why we consider it so much. We first ask, when did you last? Because for them, they only know menses. And menses is one of the phases.
So one last question, just some clarity. Would
Yes,
you
please.
advise someone that is not looking at having a child to go through the burden of doing a hormone level test?
Pardon?
Someone that is not looking at having a child anytime soon, but they're suspecting infertility. Is it worth it? Are the hormone level tests worth it if they're not looking at conceiving anytime soon? Is it
Well,
necessary?
If they are not planning to conceive,
Anytime soon, not in a year, not in 2
I
years.
don't think it is necessary unless
Mm.
this woman has got problems, maybe with her flow, her menstrual flow, maybe blood is much, a lot of clots, she has painful menses. Then I can advise that, you know what? You need to go and do some hormonal profile test, then we see where the problem is and we address it. Yeah.
This was very enlightening and very educating.
Yeah, but people shouldn't worry about that so much. Yeah, the moment you know you have not traveled, you have not changed the diet, you are not on family planning. Lastly, you are not stressed.
Oh.
Yeah. Stress also has several effects on different
How
body
does
systems.
stress affect the hormones?
First of all, it affects cortisol levels. When you're stressed, there is a lot of what I can say neurotransmitters in the blood, in your saturation, which can later on impact on your heart rate, on your respiratory system, on your brain, on your adrenal gland, finally on your reproductive system. Cortisol levels can cause a lot of problems. Stress generally is not good for
Avoid
your
stress.
health. Yeah, that's what I can say about that, and you need to discuss to your patient or your
Thank
clients.
you so much.
You're welcome.
So helpful.
Yeah. Have a good day. I think I
Have a
can
good
be
day
able
too.
to take off now.
Okay.
Yeah.